Welcome to the Victory Education Lounge. I'm your host, and today we're diving into a crucial topic that affects millions: urinary tract infections and insulin resistance. This is part 104 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Have you ever wondered if there's a connection between urinary tract infections and insulin resistance? Today we're unraveling this complex relationship that surprisingly affects a significant number of individuals worldwide. This intricate interplay may be under the radar for many, but its understanding is vital for those prone to urinary tract infections or grappling with insulin resistance. So let's delve into this fascinating topic and explore how insulin resistance can impact your risk of UTIs and what we can do about it. Firstly, we're going to talk about how high blood sugar levels can increase your risk of UTIs. You see, when our blood sugar levels are consistently high, our body's cells become less effective at responding to insulin. This leads to what we call insulin resistance, which can have a significant impact on our urinary tract health. How does this work, you might ask? Well, high blood sugar creates an environment that's just perfect for bacteria to thrive in. Imagine it like this. Your urinary tract is a garden. The bacteria are weeds that we want to keep away, but high blood sugar is like a top-quality fertilizer for these weeds. It gives them all they need to grow and multiply, which can lead to infections. But there's good news. We can manage this risk by controlling our blood sugar levels. This can be done through a balanced diet that's low in refined sugars and high in fiber, protein, and healthy fats. Regular exercise can also help, as it aids in maintaining a healthy weight and improving insulin sensitivity. And if prescribed by a healthcare professional, medication can also be effective in controlling blood sugar levels. Now, this approach does come with its challenges. It requires regular monitoring of blood sugar levels and might necessitate medication. But on the flip side, the benefits are substantial. Not only can this strategy reduce your risk of UTIs, but it also boosts overall health and well-being. Let's consider the example of Sarah. She's 45 and has prediabetes. By focusing on blood sugar control through diet and exercise, and by regularly monitoring her blood sugar levels, Sarah was able to keep her levels within the normal range. The result? She experienced a 70% reduction in UTIs over a year. That's a huge difference. So there you have it. By controlling your blood sugar levels, you can significantly reduce your risk of UTIs. It's a proactive step towards better health that can have far-reaching effects. Remember, every small change counts. Now, let's turn our attention to how insulin resistance can affect your immune system. Insulin resistance can have a profound impact on your immune function, weakening your body's natural defenses. This, in turn, can make it more challenging for your body to fight off infections, including urinary tract infections. So how does this happen? Well, insulin resistance can lead to chronic inflammation and disrupt the normal functioning of the immune system. This disruption can reduce the body's ability to respond to threats, like the bacteria that cause UTIs. This doesn't mean you're powerless, though. There are various strategies you can employ to bolster your immune system and reduce your risk of UTIs. One of these is adopting an immune-boosting diet. This means consuming foods rich in vitamins C and D, like citrus fruits, bell peppers, and fatty fish. These nutrients are known for their immune-enhancing properties and can help your body become more resilient. Regular exercise is another crucial strategy. Physical activity has been shown to improve immune function and lower inflammation levels. Whether it's a brisk walk, a yoga session, or a heart-pumping HIIT workout, any form of regular movement can be beneficial. Stress reduction techniques such as meditation or mindfulness practices can also play a role in maintaining a healthy immune system. Chronic stress has been linked to a weakened immune response, so finding ways to manage stress is important. These strategies come with their own pros and cons. On the plus side, they can enhance your overall health, not just your UTI prevention efforts. On the downside, they require consistent lifestyle changes that may not always be easy to implement. Let's take an example. Meet John, a 52-year-old who adopted an immune-boosting lifestyle after struggling with recurring UTIs. By focusing on nutrition, exercise, and stress reduction, John managed to decrease his UTI frequency by 60% within 6 months. Not only that, but he reported feeling healthier and more energized overall. So you see, maintaining a strong immune system is key in the fight against UTIs. Remember, your body is a complex system and every part plays a role in your overall health. When one part is out of balance, like when insulin resistance is present, it can impact other areas like your immune function. But with the right strategies and a proactive approach, you can help restore that balance and protect your health. Did you know that insulin resistance can also affect your urine pH? Yes, you heard right. Insulin resistance can indeed alter urine pH, creating a more welcoming environment for bacteria to grow, which can lead to urinary tract infections. But what exactly does this mean? Well, pH is a measure of how acidic or alkaline a substance is. On a scale from 0 to 14, a pH of 7 is considered neutral, below 7 is acidic, and above 7 is alkaline. Urine pH can vary depending on various factors, including your diet, hydration levels, and yes, even insulin resistance. You see, insulin resistance can cause changes in your body's metabolism, which can affect the pH of your urine. This can lead to an environment in your urinary tract that's more conducive to bacterial growth, and as we've discussed, where there's bacteria, there's potential for infection. So how can we manage this? One effective strategy is through a balanced diet. Consuming a variety of foods can help optimize your urine pH. This includes fruits, vegetables, lean proteins, and whole grains. Another key aspect is hydration. Adequate water intake can help dilute urine and make it less welcoming to bacteria. Aim for at least 8 glasses of water a day, but remember, individual needs can vary. And finally, some may find benefit in cranberry supplements. Cranberries contain substances that can prevent bacteria from sticking to the urinary tract walls. However, this should always be under medical guidance, as supplements can interact with certain medications. Let's consider Lisa, who's 38. She focused on balancing her diet and increasing her water intake. As a result, her urine pH normalized, and she experienced a 50% reduction in UTIs over 3 months. The pros of these strategies are that they can create a less hospitable environment for bacteria, reducing the risk of UTIs. The cons are that they may require dietary changes and ongoing attention to hydration. But remember, every small change can make a big difference. Maintaining a balanced urine pH can greatly help in reducing your UTI risk. So why not give these strategies a try? Let's now discuss how insulin resistance can contribute to changes in bladder function. You might be surprised to learn that insulin resistance can lead to neurological alterations that affect the way your bladder works. Essentially, the nerves that control bladder function can be impaired, leading to problems like increased frequency of urination, urgency, and even incontinence. So how do we manage this? One effective strategy is through pelvic floor exercises. Just like any other muscle in your body, your pelvic floor muscles can be strengthened through regular workouts. This can improve bladder control and reduce the likelihood of UTIs. Another method is timed voiding, which means going to the bathroom at regular intervals to prevent your bladder from becoming too full. Of course, addressing the underlying insulin resistance is a key part of this puzzle. By improving insulin sensitivity through lifestyle changes like diet and exercise, we can help normalize bladder function. But what are the pros and cons of this approach? The benefits are clear: improved overall urinary health and function, and a reduced risk of UTIs. However, it may require a dedicated exercise routine and lifestyle changes, which could be challenging for some. To illustrate, let's take the example of Mike, who is 60 years old. Mike started to experience bladder dysfunction due to insulin resistance. He decided to incorporate pelvic floor exercises into his daily routine and worked on improving his insulin sensitivity through diet and exercise. Over a period of 6 months, Mike noticed a significant improvement in his bladder function. His urge to urinate decreased, and he was able to better control his bladder. Most importantly, his UTI occurrences decreased by a whopping 80%. So, while it might take some effort and commitment, improving bladder function and insulin sensitivity can significantly decrease UTI occurrences. Remember, your health is worth the effort. Lastly, let's consider how insulin resistance can promote inflammation and affect urinary tract health. Insulin resistance is often linked to chronic, low-grade inflammation in the body. This is a silent yet persistent type of inflammation that can subtly damage tissues over time, including those in the urinary tract. This opens the door to infections, such as UTIs. To manage this, an anti-inflammatory diet is a great place to start. This includes foods rich in omega-3 fatty acids, such as fatty fish, flax seeds, and walnuts, along with a rainbow of fruits and vegetables. Regular physical activity also helps, as it can reduce inflammation and regulate insulin levels. Omega-3 supplementation can be considered as well, under medical guidance, of course. Let's weigh the pros and cons. On the plus side, these strategies can benefit not only your urinary tract, but your overall health as well. They can help reduce the risk of other inflammation-related diseases like heart disease and diabetes. On the downside, it might require some dietary changes and commitment to regular exercise. Let's look at an example. Meet Jerry, a 55-year-old with insulin resistance. Jerry adopted an anti-inflammatory diet and started walking for 30 minutes every day. He also took omega-3 supplements under his doctor's advice. Within a year, Jerry saw a 65% decrease in UTIs and reported feeling more energetic and healthier overall. Reducing inflammation not only improves urinary tract health, but also benefits overall health. So there you have it. We've shed light on the intricate relationship between urinary tract infections and insulin resistance, highlighting how this metabolic condition can increase your UTI risk. We've discussed strategies for managing each issue, from controlling blood sugar levels to strengthening immune function, balancing urinary pH, improving bladder function, and reducing inflammation. Therefore, understanding the connection between UTIs and insulin resistance is the first step to a healthier you. Remember, managing UTI risk in the context of insulin resistance requires a comprehensive approach. By addressing your metabolic health, you're not just reducing your risk of UTIs, you're supporting your overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to UTIs and insulin resistance, should be discussed with a licensed physician or qualified healthcare professional.